going to go ahead and get started. Our presentation today is over the Code of Ethics in the workplace. Well, it's not going to be just Code of Ethics for one particular field. It's going to be Code of Ethics for every field. So whatever field you're in, we'll have something for everybody. What's going to be great is we're going to at some point break up into little dyads, triads, and try to problem solve together and try to figure out some scenarios through this presentation. So everybody's code of ethics is going to be very different. I know after more than 50 years of social work, it's a lot of different pages of ethics and a lot of different requirements. So the wording's going to be a little bit different, but the principles are pretty much the same. I remember going into this field and thinking to myself, what am I supposed to do? I had no idea. And I remember people telling me, well, just imagine that you have 60 minutes following you everywhere you go. And that'll give you a good idea of your ethical strategies out in the community, but I don't like thinking of it that way. That's kind of scary to me, but in a way that's what's right. We do need to be thinking about, well, are people watching? Yeah, they are. They are watching, but we really should be watching ourselves too, watching what we're doing. So hopefully after tonight, we'll get a little bit better understanding how to maneuver, and that's really what I'm going for. This is an introductory to the Code of Ethics, and pretty much how to use your own Code of Ethics, how to look things up, how to find information. That's very, very important because I believe that you can find what you need through your Code of Ethics, at least point you in a direction to get your needs met.
When you use the term your Code of Ethics, when you said your Code of Ethics, do I infer from that ethics is relative to each person's own moral compass?
Good question. You would think so. But the job criteria, Code of Ethics, and your professional field you're in, very different story. So yeah, it's going to be different. Here you go. Here's a couple different sites that you can go to on your phones or through those that are joining us through the internet. They can be able to find through that way. Dr. Google will help you to find what you need. But for the counselors, we use the ACA Code of Ethics. For the social workers, they use the NASW Code of Ethics. And I've been informed Cbrs case managers, they use the site here. Supportive services, there's another Code of Ethics through their sites. So if you follow these online sites, you should be able to find your Code of Ethics. And maybe go ahead and try to find that right now, because we are going to be using our Code of Ethics tonight. So find which area that you use for your job. Might be Idaho Support Services. You'll be able to find if you're doing peer support, you'll find that under that area. I should have wrote down the keywords in the Google to be able to find it, but you will need this because I'm going to give you some scenarios. We are going to be going through these. This is a hands-on CU today. So backing up, let's get to know the code. Captain Jack Sparrow knows how to break the code. Do we know how to keep the code? Well, we can't keep the code if we don't know what they are. Most have an overview. If you can follow along with me in your Code of Ethics, can you find your overview? Are you able to find that? Let's look it up right now. All right, according to my code of ethics, the NSAW code of ethics is a set of standards that guide the professional conduct of social workers. The first section will have a preamble. Many code of ethics will have a preamble. Something that summarizes what you do, your mission, your core values. Values don't change usually. They may shift by our decision making, but they don't change. Values don't change. So there's the overlap in our code of ethics will be our values. The purpose. Most code of ethics will have a purpose of your ethics, what it's used for. Main functions, brief guide dealing with your ethical issues, or the dilemmas. Usually there's a table of contents that you can go to be able to find the areas that you need to find. Like I said, we should be referring to this code of ethics often to be able to answer our problems. And when I don't know an answer to the question, and I don't know a lot of answers, I'll say, well, what does your code of ethics say? Or sometimes I'm up late at night and I'm thinking, I feel a kind of ethical dilemma. And I'll have to refer to my code of ethics, and then I might refer to a counselor's code of ethics and see how they deal with an issue to get a better understanding of how things cross over. I think it's important to know other people's code of ethics and how they handle situations too. That's very important. Ethical principles based on your core values, ethical standards, specific ethical standards guide what you do, your conduct. So here's an example of a preamble. So here's some good values on the bottom of there. It says your service, your social justice, dignity, worth of the person, importance of human relationships, integrity, competence. Those are pretty good values. I value those things. Go ahead.
I've had a hard time defining or differentiating between, quote, social justice and justice. Because social justice is often referenced phrase, but in the context of its discussion, they don't define with specificity what the social justice means. They assume you know the definition.
Good question. I don't know all the answers to questions either. We may have to ask a question for somebody else. If you still have that question for me at the end, let me know, and I will have an answer for you later. Okay? And if I can't answer the questions tonight, which I may not, I will refer back. I can refer back to you. You're welcome to email me.
When you say importance of human relationships, there's a couple organizations that are, you might say, multi-professional, kind of more universal, and the common way of looking at human relationships is we should treat human beings that we interact with as ultimate ends, not means to end.
According to your values?
Well, I think that's supposed to be a universal. I mean, this goes back in a non-religious context. The German philosopher Martin Buber, his I thou paradigm. If you look it up, Martin Buber, he serves as the fundamental intellectual foundation of the Arbinger Institute, who has international consulting in ethical behavior between colleagues in work environments, and they consult for major employers, Fortune 1000 companies, nonprofits, government agencies, So anyway.
So, wealth of information there. But what one person studies may not be what another person studies. So there has to be some direction there. We have to have some confidence in what we're doing. So we have to have an outline, okay? We have to have a basic outline to be able to maneuver. And my motto has always been the KISS method: keep it simple, stupid. If I try to look outside the lines, outside my lane, usually I'm going to end up getting in an accident and get hurt. Okay. So if I feel like I'm getting outside my lane in my code of ethics, probably time to maybe go to my supervisor, go to my team leader, go to a clinical professional to get a better understanding. Like I said, I don't know that all the answers, and you're right, social justice does change often. Their perspectives change often, and even psychology is changing often. A lot of our technology, a lot of the things that we're learning now is going to be different, maybe irrelevant, year, 2 years, 10 years down the road. There's so many different things coming out there. Did you know that anybody ever heard traumatic brain injury? Well, that wasn't even talked about till after Iraq. We've only had this information for like the last 15, 16 years. Until after these roadside bombs and soldiers are getting hit by these IEDs. I kind of look at it as like, this is probably horrible to say, but it's kind of shaken baby syndrome for adults. You're getting jarred around there, okay? And is very confused. I don't want to go on a tangent there, but yeah, I was confused with PTSD, shell shock, and a lot of different things. Okay, we're going to go ahead and move on. You're going to have to find your purpose. What is the purpose of what you're doing in your code of ethics? And the different fields, your purpose is going to maybe very different. These are just examples I'm showing you. This doesn't mean this is across the board here. And I don't want it to be across the board. I just want to give you kind of a little bit of a guideline to be able to look for your own information, because you will need to maneuver around your code of ethics in your career. Ethical principles, look at those values. They're showing up again. Value, service, social justice, dignity, worth of the person, importance of human relationships, integrity, competence. And values piggyback on one another, don't they?
There is one mention there, when professional obligations conflict.
Mm-hmm.
Did you think of any situations where that would be sort of a rock and a hard place?
Oh, we're going to get into several of them today. I've got several scenarios for you. And you're going to have to come together as a group, and you're going to be able to have to look at maneuver in your own code of ethics and talk about it amongst each other. So we're going to have some fun today. Hopefully we'll make it fun. We'll see where it goes. I'm interested to see how all these different code of ethics work together and how you guys can describe the code of ethics amongst one another and come up with a decision. There's some ethical standards there. Ethical responsibilities of clients, social workers' ethical responsibilities of colleagues, social workers' ethical responsibilities in practice settings. There's going to be different areas that you're going to be able to look for. This will help. Your code of ethics should guide you in the community, in your workplace, moral dilemma you may have, maybe observed behavior, maybe you're angry and need to figure out why you're angry about situations going on, or something you're observed. Consult the code of ethics first. Get some idea where you're going through. Get some guidelines. All right. Let's go ahead and try to break the code. Here is your first scenario. Jared is working to teach his client how to set boundaries with peer family members. Jared received an anonymous text saying that they have information about his client's mental well-being. The text used the client's full name. The person did not identify themselves, and Jared is not sure how they got his phone number. After work, Jared walks out of his car and is approached by an unfamiliar person who says, "Did you get my text?" referring to his client by name. All right, what do you do? I'm going to go ahead and turn the mic off, and you guys are going to make a little circle, and you're going to refer to your code of ethics. Test, test. Did we have any questions through the online, right? Okay. Okay. So I'm going to do a little bit of interaction with you guys. So what area are we looking at right now?
I'm trying to pull up Cbrs.
Okay.
I tried it once and I failed, so now I wrote it down to see if I could actually spell it right and have all the right letters.
Okay. Is anybody having any hard times finding their code of ethics on their phone?
I can bring my phone in the car, but
Okay.
I know it's very clear in peer support some of the things you can do and rules and regulations regarding our behavior on and off the clock, and it's very clear.
Okay. Let's go ahead and find those. If those that maybe peer support, I'm going to have you team up. Do you have your phone on you? Awesome. Can you pull up the peer support code of ethics? Are you pulling up the CBRS codex, the community? Let me refer back here. There you go. There's your site. That will take you directly.
Okay, we're gonna try. It's there. So.
And it usually gives you an option where you can download a PDF too.
Oh. I always just say it, so I don't even know how to do it. I just say it and it goes in. It's just there and then I type it.
So maybe go into the address and type it in exactly the way you're seeing it on here.
That's what I'm trying to do.
And then once you get it, put it on your favorites. So I'm sitting here going through mine, and right now I'm going through social work, ethical responsibilities, confidentiality. Mine is 2.02, confidentiality. Social workers should respect confidential information shared by colleagues in the course of their professional relationships and transactions. Social workers should ensure that such colleagues understand that social workers' obligation to respect confidentiality and expectations related to it. So that's just one area in there.
Is there any way that you can get information from this guy who plausibly knows some key info about your patient that you may not know without violating that confidentiality?
Let's look at the dilemma here. Let's find the dilemma in our code of ethics. So we're going to have, number one, we're going to have to find our code of ethics in our phones, in our PDF. You will have to find your code of ethics and bring this up. So we don't want to look past the mark here first. We want to look at what code of ethics is being challenged here. So I'm seeing here for myself, confidentiality. Yeah, I'm looking at here another area, 2.09 in mine, incompetence of colleagues. I'm like, okay, is my colleague very competent? Do I want to share valuable information with this person? Man, it's going to take some repairs after this to be able to work this out. And here it says what I should do is consult with that colleague when feasible and assist the colleague in taking remedial action. So I may be doing a lot of educating. I'm not going to sit here and say, oh, man, can you believe what so-and-so did? No, first I'm going to go to the person directly. It says social workers that believe a social worker colleague is competent and has not taken adequate steps, is incompetent and has not taken adequate steps to address the incompetence should take action through appropriate channels established by the employers, the agencies. Do you know the agency's policies and procedures on how to deal with these situations? Most do. Most agencies have a policy and procedure on how to deal with certain situations that can be across the board. Yes.
Denial of a life. I mean, it's not giving us a list. You look up their ethical practice.
So does it give you a table of contents to maneuver? Okay. These are good questions. It's not easy to maneuver around this. Another one in mine says unethical conduct of colleagues, 2.10. Says I should be knowledgeable about the policies and procedures of the agency I'm working for, how to handle sensitive issues, licensing, what licensing looks like. Let's see. That's just a few. There's a lot of different directions. We're going to go ahead and move on to the next scenario. Are we all there yet? Okay. So maybe we'll slow down a little bit even further. Find your table of contents in your code of ethics. Any questions online? No. Are they having any problems finding their table of contents on the code of ethics? Online? They're doing okay? Yeah, if you have any questions, please put them online so we can answer them. There's your scenario. Ooh, that's scary, being approached by somebody I don't even know because of code of ethics are broke. Some incompetence that could have been prevented. I don't know, maybe some CEUs. Have some CEUs on how to be more safe.
Regarding a situation with a peer, and it was very uncomfortable. I told him I couldn't talk to him. And then I went directly to the peer and got a release of information so that I could talk to him. And I said only a few things that she allowed me to say. Very, very frightening being in that position.
Having some support, some directions, invaluable during times like that. Okay. While you guys are still finding that, let's go ahead to the next one. Serena is working to assist in improving her client's self-confidence. The client has stated that they have an idea to start a business, refurbishing old bikes and selling them on a Facebook page. Serena is part of this Facebook page that the client is talking about. Serena is excited that her client has identified a task that will help build the client's confidence. The client requests Serena's assistance in posting the information on a Facebook seller's page. Serena agrees to posting the items using her account, and the client says she will share part of the profits with Serena. The client sends a Facebook friend request to Serena. Oh boy. You know, we live in a day and age where we have to interact on the internet. I mean, right now we've got people watching us, what we're doing right now, trying to get a CEU. So there's a lot of ways that the information can be passed on, and people's personal lives and safety. I don't know. What's the code of ethics saying this? Well, right off the bat, I'm sitting there looking at mine. It says 4.03, private conduct. Social workers should not permit their private conduct to interfere with their ability to fulfill their professional responsibilities. That's one. Competence has been kind of flushed down the toilet here a little bit. So maybe we have to do some education, some supervision here to help. I want to hear some comments of your own code of ethics. I'm really excited to hear some of the different areas. Go ahead.
From here. So on principle B, integrity number 5, it says practitioners act fairly and honestly in professional relationships and business practices and do not exploit them for personal gain or benefit.
Do you feel like it's clear?
Yeah, I think they're crossing the line on that one.
Okay. Let's see if we can find some more. I want to hear from other areas. I want to hear from peer support. I want to hear from community programs. If there's some counselors online, I'd love to hear from the counselors if they're able to find some things from their code of ethics. Cbrs case managers are representing.
And peer support, essentially. The peer support code of ethics says do not accept gifts of significant value from those they serve. I know that's also the same with Cbrs and case managers. We are not allowed to accept money from our clients. Also, she should really connect the client to the information and see if the client has a friend that can help them set all of this up rather than her herself.
Perfect. Straight from code of ethics.
If you're a medical insurance agent selling some form of health insurance, sometimes you get into they have a health problem, there's a claims problem they want you to help resolve, or be an ombudsman about getting a claim adjudicated, and you inevitably get into the particulars of their health issue. You know, and I guess I violated a couple of these ethics issues by not getting written permission to disclose her health information related to the claim when I'm trying to deal with various bureaucrats in insurance company or et cetera.
Awareness is most of it, isn't it? I got a little clip for the very end here. Where is that? Oh, there we go. The code is more what you call guidelines, but they are actual rules. Okay. Never mind what Balboa says at the end of it. They are guidelines. We do have to follow them, but they're there for a reason. They're there to help. So it's not there to beat you up. You're human beings, okay? So yes, we are supposed to be competent, but to be competent, we need to have the awareness. We need to be looking for it, know where to look for what we need. Anybody else find another part of their code?
Under integrity for CBRS, it says practitioners foster the trust of persons receiving services and do not exploit them for personal gain or benefit. And I think that's pretty tricky because we're trusted with so many things, sometimes even more than what a counselor knows. And then we're carrying around this information and we have to be so careful. Like maybe we're talking to Blue Cross, like their care coordinator or something. And it's like, how much of that can you really even share? You know, so you have to be, I am always afraid to almost say anything.
What?
Yeah, so that's full disclosure then.
So maybe a good idea to be able to know what your code of ethics are. This stuff's free to look online. You can look at the counselor's code of ethics and social workers' code of ethics and get an idea of, wow, what do we have to do? I promise you, as professionals, as counselors and therapists and social workers, it is a lot. It is a lot. There are so many different ways we can break the law, and we have to have guidelines. We have to have a map. We have to have supervision constantly. I don't know where I would be in my job without my supervision, without the help that I have, because I make mistakes a lot. Okay, I don't know everything, and I don't try to come off that way that I know everything. I have a lot of different experiences, but it doesn't mean I know all the code of ethics. And there's a lot. There's a lot of different ways to break the law. But they're there to help. Yes?
Hello? Okay. We do have a comment from Jackson.
Okay.
He said, media and codes of ethics get tricky very quickly. Whatever's posted online is forever, even when we delete our post. It is seen by others and it impacts anyone who sees it. As a professional, we have to be careful because even with high privacy setting clients, potential clients and others see what is out there and make judgments about us, agencies, and the profession in general.
Ooh, I love Facebook, and I post a lot of stuff out there. And sometimes he's correct. Sometimes I'm taking things down. Sometimes I'm putting things on private, only I see. And that's something I have to work on myself. What was this? Was that a comment or a question or both? Okay, thank you, Jackson. Yeah, he's exactly right. Once it's put out there, it's not coming back. Yeah, I didn't even think about that. Screenshots. But yeah, your stuff's going out there. Social media is a big part of our life now, and it's not. I don't see it going away. And they're adding stuff to the code of ethics with social media too. It's coming directly. It's being reamped as we speak. It's my understanding we're gonna have a whole lot more code of ethics come after this year. Did that suffice, Jackson? Okay. Anybody find anything else in their code of ethics? All right, let's go to the next one. Benjamin's caseload of clients has been getting low over the last 2 months. He has a client who he knows is ready to be discharged from services, but Benjamin enjoys this client's company so much, and they often go out for coffee to shoot the breeze. Benjamin continues to see the client despite the client meeting his goals because he fears not making enough money to cover his bills. Benjamin also decides to sell baseball cards online while with his client because his client likes looking at baseball cards too. Oh, they got so much in common. Such a good relationship. It sounds like a great experience. Sounds like they built a really good therapeutic relationship, but it's time to be done. But what's in conflict here? Can you look at your code of ethics and find which areas may be in challenge here? So I'm looking through mine. Is that in your code of ethics? All right, let's hear it. This is coming from peer support, Cbrs.
It's peer support, but I'm pretty sure case management has something similar. Peer support specialists do not enter into dual relationships or commitments that conflict with the interests of those they serve. So this is definitely that conflict because he's not serving this person by continuing to work with them. And also, there's probably clients on a wait list that he could take. So he's not serving himself any better either.
Perfect. Yeah, there's missed opportunities here. There may be other areas, other goals to make as in the relationship. They could be setting goals to move out of this relationship to bigger, better things. It may be other services too. Able to help in different areas. Who knows? But we're not doing our clients any favors by stringing things on. Anything else? Well, mine's 4.04 is showing dishonesty. It could be fraudulent. If I'm not doing them any services, the service has already been done. I may be duplicating services here.
He's also challenging himself. He's resting in his laurels of his comfort zone of enjoying the relationship, but not really helping the client. So it is a dual relationship.
Okay. Thank you.
I said pretty much everything on the integrity. It would be,
Give us your best one, integrity.
all right. Practitioners strive to resist the influence and pressures that interfere with their professional performance. So he's just letting personal influences interfere with what he needs to be doing professionally, his personal interests.
But then read the next one, read number 3, because that kind of goes with that.
Practitioners are continually cognizant of their own needs, values, and potentially influential position in relationship to a person receiving services.
So you could kind of say, well, hey, you should do this baseball job like I am. Look at all the money I'm making. You know, I mean, you can influence in a way that might not be really helpful to your client. Because you're both passionate about something, but it might not work. I actually had this with a client. She went into a little side business that I'd been doing, and I gave her some ideas. I said, but guess what? Like, it's a hard business, and it's not very profitable at times. You might be using it as a coping skill, and this is what her counselor wanted her, you know, we talked about it would be a coping skill, and it was, you know, but she's got a regular job now, so, but it's hard because you don't want to over-influence somebody when you have a commonality like that.
Oh, that's true. I mean, if they want to keep this relationship going so long, they're willing to take on your values. That's not good. I don't want people being a chameleon trying to clone me. I want them to do their own thing. So it's right. People can try to take on other people's values, and then because they may not value the same things I value, and that could turn to resentment really quick. And the resentment usually turns to anger, and then bad things happen. And then we're getting some bad reviews. And we just ruined a relationship. And that's the most important thing, the relationship, isn't it? Okay, let's go ahead and move on. What did I do with that little clicker? Anybody, do we have any responses from those watching? Do they have any comments? Okay, we can go back.
So from the last one, and if you do have a comment, you can post it. There's a little bit of a delay, so we don't always see it right away. So Katie had said on the last scenario, as a peer support, this scenario would present a great opportunity to empower the client by helping them post or set up their business under their own profile. Serena's name should not be connected to the business, and of course, shared profits would be against the code of ethics. All support could be offered during designated peer support time.
Perfect. Thank you so much. Okay. Jack is noticing that a client is showing up on his Facebook as a suggestion to add as a friend. He starts to pay more attention to shared friends in his safety settings. As he pays more attention to details, he noticed a client commenting on his post. Jack looks at the shared friend setting and discovers one of his coworkers has added the client as a friend. Oh boy. He also discovers through social media that the client is self-harming and suicidal. All right, let's go to the code of ethics. See what you can find in your code of ethics. Well, I keep going back to my first thought, competence. How competent are we? Am I going to have to do some re-educating again? Maybe go to the person I'm struggling with that has these clients as their friends? Do I need to be letting them know, hey, don't do that? The professional is the one I should be talking to, right? I don't want to beat up the client. I need to go to the professional or the person that's working with the agency. confidentiality breached? I don't know if this person's expressing their needs on social media. Yes.
I should turn my mic on before I raise my hand. So Amy says you should not look at the client's mutual friends. That's an ethical issue for them, just as it is the person's friends with them.
Say that one more time.
Sorry. You should not look at the client's mutual friends. That's an ethical issue for them, just as it is the person's friends with them.
So if people start posting on Facebook and start expressing their suicidal on their own sites, then what do you do, Amy?
Might take a minute.
Tell me your code of ethics. What's your code of ethics tell you? Oh, can it? Okay. Okay. We live in a small town, okay? We do live in a small town. Are we going to be able to prevent everything? No. But we do need to be able to protect confidentiality. I think that's important in mind, looking at my code of ethics. Should I be looking at other people's stuff on Facebook, looking people up and trying? No. No. Not a good thing. And yeah, the chances of you finding out things you probably didn't want to hear are highly likely if you're looking these people up.
So Amy did respond back. She said, contact your supervisor and ask for guidance. And then she said no, but I don't know what no is in reference to.
Okay. I was just curious if she was able to refer to her Cbrs code of ethics, community code of ethics, if it had something in there. We're learning, I see in the next few years, it's my understanding that they're reamping a lot of the code of ethics to meet social media. And that's to my understanding, okay? But when I was going through grad school in Montana, there was agencies there that were looking at the workers' Facebook stuff and their social media and seeing what they were posting and directly contacting the associates that worked there. But they did sign an agreement before they worked there that they could have their social media screened. So they agreed to that before they even went into their agency. So that's a company policy and procedure that was in place by those people in Montana that I was in contact with. I don't know. It's a lot of discretion that the policies and procedures and, well, your code of ethics. Have we is there anything else? I want to hear from Amy. Amy, is there anything else you want to add to this? I do value Amy's comments. Okay. We'll go ahead and move on. Joe notices coworker Faye is often late getting her clients, and that Faye becomes agitated when with a particular shared client. The client also shared with Joe that Faye talks about what she does not like about the client to the client and is often on her phone during session. Ouch. What's your code of ethics tell you? And I really should have printed off the policies and procedures of the agency here, but no, those are probably personal, not information we would give the community, but I would be interested to know. Maybe I'll print off some, look it over myself. All right. Let's hear it. Peer support.
All right, so for peer support, it says peer support specialists maintain high standards of personal conduct and conduct themselves in a manner that fosters their own recovery, but she's obviously not conducting herself in a positive way. And peer support specialists never intimidate, threaten, or harass those they serve, never use undue influence, physical force, or verbal abuse with those they serve, and never make unwarranted promises of benefits to those they serve. So she's clearly not enjoying working with this person and should talk with her supervisor about changing and having that client move to somebody else.
Thank you. Something's going on. Something's going on. It sounds like it's kind of going both ways here. Okay, it may be just not a good fit, and that's okay. It's okay to not have good fits. Sometimes we need new. Sometimes we need other resources, and that's okay. So is it our ethical responsibility to link and coordinate them to someone that can better serve them? Absolutely. Absolutely. And maybe let the client know that you're trying to look out for the best benefit.
Treat them as a human too, I think is very important. Treat them as a human and admit you're human, and that she didn't realize, hopefully she didn't realize what she was doing, and then would learn from it and change her behavior too.
Thank you. Yes, we need to treat people with respect. Absolutely. Let me see if I can find something in my code of ethics. See some.
There are things that I don't like about you, and she's just, is the worker saying to the client, I don't like this about you? Or is she saying it to the other worker?
The worker's saying that to the client.
Like, why would you be so offensive to your client? Like, that doesn't even make sense to me.
Good question. Let's consult the code of ethics. All right, I see an area that may be broken in 2.10, unethical conduct of colleagues. Social workers should take adequate measures to discourage, prevent, expose, and correct the unethical conduct of colleagues, including unethical conduct using technology. Social workers should be acknowledged about established policies and procedures for handling concerns about the colleagues. Sounds like this person went to their supervisor, went to the right person, their direct person. They didn't triangulate and start talking bad to everybody. Like, can you believe what Faye said and did? She's not sitting there going to all her friends. She went directly to her supervisor, which was the right thing to do. There's possibility for misrepresentation here too. Under mine, it could be 4.06. We don't know exactly what's going on, and so we might need to get some clarification from a clinician or supervision. I know here it's required to get. I think the state of Idaho is required to get supervision by clinicians. So perfect time. You have individual and group. These are some things maybe to bring up in individual supervision with the clinician to get better understanding of what to do, some direction. They may refer you to your code of ethics first and then give some education. And then again, maybe look at your policies and procedures for your agency too. Or, yes, CBRS.
CBRS has a huge principle of respect for diversity and culture, and I think that would probably speak to all of that. I mean, most of our clients might have different values and culture and just the way of living their life than we do, but we still have to respect where they're coming from, how they were raised, and who they are, and help them in their journey. I mean, like I've had clients that are meth addicts. Well, I've never been a meth addict, but I still have to respect that's part of their journey, you know, and I can't judge them for that. All I can do is help them with services to help them get through that, whatever that is for them.
Great, that's perfect. Diversity, yeah, there's going to be a lot of diversity. We don't know the walks of life. There's so many people moving around here in the United States right now, and the human condition's changing so much. And I think it's important to be aware of the needs. Like you said, I tell you what, culture is different in different places in the United States. Just because you live in the same country doesn't mean you have the same culture and same experiences. So you're right on. Great. Okay, peer support.
I lost it.
Oops, sorry.
Remain aware of, a peer support specialist remains aware of their skills and limitations and do not provide services or represent themselves as experts in areas for which they do not have sufficient knowledge or expertise.
Okay, so I'm hearing you say, don't say you're an expert when you're not. But can we be professionals in our field? Absolutely. Being a professional and an expert is two different things. I think we can be professionals in whatever we're doing. Is it nice to hear things that we're doing wrong? No, but it is good for growth. And everybody receives feedback differently. So, perfect. All right, let's see where I mean, we're about out of time. Do we have anything else? Anyone more? All right, let's bring it back in. We're about out of time, so we're going to wrap things up. Quickly, did we have any aha moments? What really spoke to you today? We have some ahas? Anybody like to share? When is the best time to reference the code of ethics? Anytime. Anytime. Refer to it often. How can the code of ethics empower yourself and others?
Good to be reminded of what the rules are in black and white so that we're not. It's good to know what the rules are in black and white so you can see what the truth is.
Absolutely. Do I trust that the code can keep me safe? Yeah. If we follow it. Well, are they rules? Yes, they are rules. Are they guidelines? Yes, they're that too. Can I trust them to keep me safe? Yes, we can trust them. If we don't, I just want to add, anytime that I'm in doubt and I'm not feeling good about decisions or I'm sitting on things, it's probably my good indicator from my gut to be talking to someone that's a professional or an expert that can give you more direction. Because I know the more supports I have in my field, the more confident I feel, the less anxious I feel about the situation, and I'm able to get the guidance that I need and the support. But it's a pretty lonely world when we try to do things by ourselves and not have guidance or supports. So please reach out to those that you have around you. Build those relationships.
I think it's important to have a moral sensibility, because you know when you're rationalizing and trying to squeeze the limits of a particular definition in the code.
We can try to justify all we want, right? So we don't want to justify things. We need to know. We need to know. And the way I know is I have peace in my decisions that I make, and I feel supported. So if I have peace and support, then I know that I'm on the right track and I'm not in far left lane where I can get hurt. And there's going to be times where we swerve and we may be wrong, and there'll be people there to steer us back. And those people are called your friends. They're called your peers, or they're usually those people that care about you, your support. And so we'll go ahead and end on that note. Any questions for online before we head out? All right, we're good. Thank you for coming out to your code of ethics.